Question 1. A nurse is assessing a child who begins wheezing and scratching their neck after eating peanut butter. What is the nurse's first action? A. Call the child's parent. B. Administer diphenhydramine. C. Inject epinephrine. D. Place the child in a side-lying position. Answer. C. Inject epinephrine. Rationale. The first-line treatment for anaphylaxis is immediate intramuscular epinephrine. Antihistamines like diphenhydramine may be used later, but are not effective alone for anaphylaxis. Contacting the parent and positioning come after stabilizing the airway. Question 2. A nurse is caring for a patient with a known shellfish allergy scheduled for a contrast-enhanced CT scan. What is the priority nursing action? A. Notify the radiology department. B. Document the allergy in the chart. C. Confirm for access. D. Pre-medicate with corticosteroids. Answer. A. Notify the radiology department. Rationale. Iodine-based contrast agents may trigger a reaction in patients with shellfish allergy. The radiology team must be informed to assess risk or choose alternatives. Documentation and pre-medication may follow, but notifying the team is first. Question 3. A patient with a severe egg allergy is admitted. Which menu item requires further evaluation? A. Vegetable soup. B. Oatmeal with raisins. C. Pancakes with syrup. D. Fruit salad. Answer. C. Pancakes with syrup. Rationale. Pancakes commonly contain eggs. This item must be checked for ingredients or substituted. The other options are unlikely to contain egg, though verification is always essential. Question 4. During discharge teaching, which statement by the parent of a child with a peanut allergy indicates a need for further teaching? A. We will carry the epinephrine injector everywhere. B. We'll have a medical ID bracelet made. C. She can eat foods labeled may contain peanuts if she's careful. D. We'll inform the school about her allergy. Answer. C. She can eat foods labeled may contain peanuts if she's careful. Rationale. Even trace amounts of peanut can cause a severe reaction. Foods labeled may contain should be avoided. The other statements show appropriate understanding of safety measures. Question 5. A nurse is educating a group of parents on managing food allergies in children. Which teaching point is most critical to include? A. Keep antihistamines in the school backpack. B. Monitor for a rash after meals. C. Have an emergency action plan and epinephrine accessible. D. Let children self-report symptoms before taking action. Answer. C. Have an emergency action plan and epinephrine accessible. Rationale. Having a clear, accessible action plan with epinephrine is vital to prevent death from anaphylaxis. Monitoring and antihistamines help, but are secondary. Children may not be able to report symptoms reliably. Question 6. A nurse is reviewing a patient's allergy list before administering a flu vaccine. The patient reports an egg allergy. What should the nurse do? A. Administer the vaccine as planned. B. Hold the vaccine and notify the provider. C. Give the vaccine with diphenhydramine premedication. D. Refer the patient to an allergist. Answer. B. Hold the vaccine and notify the provider. Rationale. Egg-based vaccines may cause a reaction in egg-allergic patients. The provider must assess risk versus benefit. Some flu vaccines are egg-free, but confirmation is needed before proceeding. Question 7. Which nursing intervention is appropriate during a rapid allergic reaction to food in a hospital setting? A. Elevate the legs. B. Administer oxygen and prepare for epinephrine. C. Start CPR immediately. D. Offer cool compresses for itching. Answer. B. Administer oxygen and prepare for epinephrine. Rationale. Airway and oxygenation are priorities in anaphylaxis. Epinephrine is the drug of choice. CPR is only started if the patient collapses. Cool compresses are not sufficient in severe reactions. Question 8. A school nurse finds a student with a swollen face and drooling after lunch. What is the best immediate response? A. Give water to flush the allergen. B. Escort to the school office. C. Use the student's epinephrine autoinjector. D. Call the student's parent. Answer: C. Use the student's epinephrine autoinjector. Rationale: facial swelling and drooling suggest airway compromise. Immediate epinephrine administration is life-saving. Delaying for parental contact or escorting wastes valuable time. Question 9. A nurse is caring for a newly diagnosed patient with celiac disease. What is the appropriate dietary teaching? A. Avoid all dairy and nuts. B. Only eat wheat in moderation. C. You must eliminate gluten entirely. D. Avoid spicy foods during flare-ups. Answer: C. You must eliminate gluten entirely. Rationale: celiac disease requires strict lifelong gluten avoidance to prevent intestinal damage. Moderation is not safe. Dairy and spice tolerance vary individually. Question 10. A parent asks how to prevent peanut allergies in their newborn. What is the most evidence-based nursing response? A. Delay peanut exposure until age 5. B. Introduce peanuts at 1 year under provider guidance. C. Avoid peanuts completely during infancy. D. Wait until the child shows interest in peanuts. Answer: B. Introduce peanuts at 1 year under provider guidance. Rationale: current guidelines recommend early, supervised introduction of peanuts in infants at risk to reduce allergy development. Delaying increases the chance of allergy. Question 11. A nurse is admitting a patient with a history of food allergies. Which documentation is most important for patient safety? A. The specific foods the patient avoids. B. Previous family reactions to foods. C. Emergency contact information. D. Severity and reaction type to each allergen. Answer: D. Severity and reaction type to each allergen. Rationale: understanding reaction severity helps guide emergency care and risk prevention. Avoidance information and contact data are useful, but not as critical. Question 12. A patient with a soy allergy is prescribed medication. What is the nurse's priority before administering it? A. Ask the patient if they've taken it before. B. Review the inactive ingredients for soy. C. Give a test dose. D. Document the medication lot number. Answer: B. Review the inactive ingredients for soy. Rationale: medications can contain soy in fillers. Reviewing all ingredients avoids triggering a reaction. A test dose is unsafe without verification. Question 13. A nurse on a med-surg floor notes a tray delivered to a patient with a milk allergy contains yogurt. What should the nurse do first? A. Remove the yogurt immediately. B. Call dietary services to replace it. C. Ask the patient if they will eat it. D. Document the error in the chart. Answer: A. Remove the yogurt immediately. Rationale: preventing exposure is the first step. After removal, dietary should be contacted. Asking the patient or documenting is not the immediate action. Question 14. A patient develops hives and throat tightness after dinner. What is the best initial nursing intervention? A. Take vital signs. B. Notify the healthcare provider. C. Call the rapid response team. D. Administer diphenhydramine. Answer: C. Call the rapid response team. Rationale: throat tightness indicates airway risk. Activating the response team ensures timely support. Antihistamines may be too slow in a severe reaction. Question 15. A nurse is teaching a patient about reading food labels. What should be emphasized to avoid allergic reactions? A. Look for nutrition values. B. Focus on fat and sugar content. C. Read the ingredient list and allergen warning. D. only read the cooking instructions. Answer C. Read the ingredient list and allergen warning. Rationale. The allergen statement and ingredient list are essential for identifying hidden allergens. Nutritional content is secondary to allergy prevention. Question 16. A patient with a wheat allergy reports using a skin lotion that caused itching. What should the nurse assess first? A. Date of product expiration. B. History of skin conditions. C. Ingredients of the lotion. D. The patient's anxiety level. Answer C. Ingredients of the lotion. Rationale. Topical products may contain allergens like wheat, e.g., in vitamin E or hydrolyzed wheat protein. Identifying the ingredient is key. Question 17. In educating staff on preventing allergic reactions in long-term care, which practice should the nurse emphasize? A. Double-check all food trays against allergy records. B. Serve meals quickly to reduce delays. C. Use disposable utensils. D. Allow family to bring food. Answer. A. Double-check all food trays against allergy records. Rationale. Verifying tray contents against allergy info prevents exposure. Disposable items and family food may be unsafe unless carefully screened. Question 18. Which patient statement indicates correct understanding of using an epinephrine autoinjector? A. I should inject it into the muscle of my arm. B. I'll use it only if I stop breathing. C. I inject it into my outer thigh. D. I take it with food. Answer. C. I inject it into my outer thigh. Rationale. The correct site is the outer thigh vastus lateralis for fast absorption. Delaying until respiratory failure is unsafe. Question 19. A patient newly diagnosed with tree nut allergy asks about dining out. What is the best nursing advice? A. Carry a list of unsafe restaurants. B. Avoid ethnic foods completely. C. Inform restaurant staff and avoid shared utensils. D. Dine only at fast food chains. Answer. C. Inform restaurant staff and avoid shared utensils. Rationale. Communication and avoiding cross-contact are essential. Ethnic or fast food labels don't guarantee safety. Question 20. A nurse receives a report about a patient with a life-threatening allergy to kiwi. What is the most appropriate action? A. Document the allergy in red ink. B. Ensure the allergy is flagged in the EHR and on armband. C. Notify the dietary department only. D. Write it in the nursing report. Answer. B. Ensure the allergy is flagged in the EHR and on armband. Rationale. Proper EHR alerts and visible identification reduce risk. While documentation is important, it's insufficient without visual and system-wide alerts. Question 21. A nurse is reviewing a school health plan for a student with a sesame allergy. What is the priority intervention? A. Educate peers about food allergies. B. Ensure staff know how to use an epinephrine autoinjector. C. Remove sesame products from the cafeteria. D. Provide hand sanitizer in every classroom. Answer. B. Ensure staff know how to use an epinephrine autoinjector. Rationale. Proper training of staff in emergency epinephrine use is crucial to immediate response during a reaction. Removing products and education help but don't directly address emergencies. Question 22. A nurse prepares to administer a new medication to a patient with multiple food allergies. What is the best safety action? A. Administer a test dose and observe. B. Call the pharmacist to verify ingredients. C. Ask if the patient has taken it before. D. Check the medication color and smell. Answer. B. Call the pharmacist to verify ingredients. Rationale. Some medications may contain allergens in excipients. Pharmacists have access to full ingredient profiles and can verify safety. Question 23. A patient with a latex fruit syndrome reports allergic reactions to certain fruits. Which fruit should the nurse advise the patient to avoid? A. Apples. B. Bananas. C. Grapes. D. Blueberries. Answer: B. Bananas. Rationale: patients with latex allergy often cross-react to bananas, avocados, and kiwis. These must be avoided. Apples and blueberries are typically safe. Question 24. Which assessment finding in a patient with a known food allergy indicates an early sign of anaphylaxis? A. Cyanosis. B. Chest pain. C. Tingling lips and itching. D. Unconsciousness. Answer: C. Tingling lips and itching. Rationale: these are often the first signs of allergic response before full systemic involvement. Cyanosis and unconsciousness are late, life-threatening stages. Question 25. A nurse teaches a patient with a fish allergy how to use their auto-injector. What action shows the need for further instruction? A. The patient demonstrates injection in the outer thigh. B. The patient says they'll go to the hospital after use. C. The patient stores the injector in a hot car. D. The patient carries 2 injectors. Answer: C. The patient stores the injector in a hot car. Rationale: epinephrine degrades with heat. It should be stored at room temperature. The rest are correct safety practices. Question 26. A nurse assesses a child with suspected food allergy. Which lab result best confirms an IgE-mediated allergy? A. CBC with differential. B. Skin biopsy. C. Serum tryptase level. D. Radioallergosorbent test, RESD. Answer: D. Radioallergosorbent test, RESD. Rationale: RESD detects allergen-specific IgE antibodies. Tryptase may rise in anaphylaxis, but RESD confirms specific allergens. Question 27. A nurse is preparing discharge instructions for a patient newly diagnosed with a tree nut allergy. What should be included? A. You can eat foods cooked with nut oil. B. Wear a medical alert bracelet at all times. C. Carry oral antihistamines only. D. Nuts and baked goods are usually safe. Answer: B. Wear a medical alert bracelet at all times. Rationale: medical ID helps first responders act quickly. Nut oils and baked goods can contain traces, and antihistamines are not sufficient in anaphylaxis. Question 28. A patient in the ICU begins wheezing shortly after receiving enteral feeding. What is the nurse's best initial action? A. Flush the feeding tube. B. Administer albuterol. C. Stop the feeding immediately. D. Recheck blood glucose. Answer: C. Stop the feeding immediately. Rationale: wheezing may indicate an allergic reaction to formula contents. Halting the feeding prevents further allergen exposure while evaluating next steps. Question 29. Which statement by a nurse caring for a pediatric patient with a soy allergy requires correction? A. I'll check all formulas for soy content. B. This baby lotion is labeled hypoallergenic, so it's safe. C. Let's alert dietary services about the allergy. D. The caregiver should be trained on the auto-injector. Answer: B. This baby lotion is labeled hypoallergenic, so it's safe. Rationale: hypoallergenic labeling does not guarantee soy-free status. Ingredients must always be verified regardless of labeling. Question 30. A child with multiple food allergies is scheduled for surgery. What is the nurse's priority action during pre-op? A. Request latex-free supplies. B. Confirm the last meal time. C. Notify anesthesia of all allergies. D. Verify consent signatures. Answer: C. Notify anesthesia of all allergies. Rationale: anesthesia must be informed of all allergens to avoid using unsafe agents or materials intraoperatively. Latex and NPO status are important, but secondary to allergy safety. Question 31. A newly diagnosed adult patient with a dairy allergy asks about calcium sources. What should the nurse recommend? A. Cheese alternatives made from soy. B. Fortified almond milk and leafy greens. C. Daily calcium supplements only. D. More orange juice. Answer: B. Fortified almond milk and leafy greens. Rationale: these are safe, natural, and absorbable sources of calcium. Supplements may be needed, but aren't the only option. Question 32. A nurse finds a patient with shortness of breath, hypotension, and flushed skin after eating. What is the first priority? A. Notify the provider. B. Start in 4-line. C. Administer intramuscular epinephrine. D. Place on a cardiac monitor. Answer: C. Administer intramuscular epinephrine. Rationale: these are signs of anaphylaxis. Epinephrine is the first-line life-saving treatment. Other actions follow. Question 33. Which intervention helps reduce food allergy-related sentinel events in a hospital setting? A. Posting food allergy signs at the bedside. B. Providing only vegetarian meals. C. Letting families bring all meals. D. Storing food in patient rooms. Answer: A. Posting food allergy signs at the bedside. Rationale: clear visual cues prevent accidental exposures by all staff. Other actions can increase risk without verification. Question 34. What is a key teaching point for a patient using a biphasic reaction tracker post-allergy exposure? A. You only need to monitor symptoms for 1 hour. B. An allergic reaction cannot return after treatment. C. Delayed reactions can occur up to 72 hours after exposure. D. Only gastrointestinal symptoms recur, not breathing issues. Answer: C. Delayed reactions can occur up to 72 hours after exposure. Rationale: biphasic anaphylaxis can return hours after resolution. Patients must remain alert to symptoms even if initially stabilized. Question 35. Which food item should be questioned for a patient with a known wheat allergy? A. Rice cakes. B. Corn tortillas. C. Soy sauce. D. Apple slices. Answer: C. Soy sauce. Rationale: many soy sauces contain wheat as a fermenting agent. Always verify brands and ingredients. Question 36. A nurse is counseling a breastfeeding mother whose infant has a milk allergy. What should the nurse advise? A. Continue eating dairy. It won't affect your milk. B. You must eliminate all dairy from your diet. C. Feed the baby formula and breast milk together. D. Pump and discard milk after eating dairy. Answer: B. You must eliminate all dairy from your diet. Rationale: milk proteins pass into breast milk and can cause reactions in sensitive infants. Total elimination is necessary. Question 37. A nurse teaching teens with peanut allergy emphasizes label reading. Which teaching is most appropriate? A. Peanut-free means completely safe. B. Look for warnings like processed in a facility with peanuts. C. You can trust homemade foods if they look clean. D. Never eat packaged foods. Answer: B. Look for warnings like processed in a facility with peanuts. Rationale: cross-contamination is possible in shared facilities. Peanut-free is not always regulated. Question 38. A patient with a severe allergy receives epinephrine and reports chest pounding and anxiety. What should the nurse do next? A. Reassure the patient these are expected effects. B. Stop all further treatment. C. Administer a sedative. D. Check troponin levels. Answer: A. Reassure the patient these are expected effects. Rationale: epinephrine often causes temporary adrenergic effects. These are normal and self-limiting in healthy individuals. Question 39. Which instruction is essential when teaching a patient how to store their epinephrine autoinjector? A. Keep it in the refrigerator. B. Store in a cool, dry place at room temperature. C. Leave it in your car's glove compartment. D. Keep it near the stove for emergencies. Answer B. Store in a cool, dry place at room temperature. Rationale: extreme temperatures reduce epinephrine potency. Room temperature in a bag or kit is safest. Question 40. A nurse observes a caregiver feeding a patient with a severe egg allergy, scrambled eggs. What is the best immediate action? A. Remove the food and assess the patient. B. Call the dietitian. C. Ask why they chose that food. D. Notify the provider later. Answer A. Remove the food and assess the patient. Rationale: the first step is to stop exposure and assess for any signs of a reaction. Education and reporting follow afterward. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.